Hello, and welcome to this edition of the ILO's Future of Work podcast. I'm Sophie Fisher. There hasn't been a time in living memory where there's been a greater focus on safety and health. COVID-19 has made us examine in forensic detail what we do in our everyday lives, how we live, where we shop, who we meet. And since most people spend a significant portion of their waking hours at work, the issue of safety and health related to work has become crucial to understanding both how the virus is spread and how we stop it. So it's entirely appropriate that this year the ILO is marking World Day for Safety and Health at Work, which is on the 28th of April, with a report on how to anticipate, prepare for and respond to safety and health crises like COVID-19. Now, we at the ILO are all still working from home because of COVID-19, but via the miracle of the internet, we are continuing to work. And I'm delighted this morning to be joined by Manal Azzi, Senior Specialist on Occupational Safety and Health at the ILO, and one of the coordinators of our report on safety and health at work this year. Manal, hi, and welcome to the podcast.
Hi, Sophie. Thanks so much for having us.
How are you? How is working at home for you?
That's a good question. It's been a struggle, I must say. But I guess like everyone else, I have to manage 3 very young kids, full-time job from home. And, we don't have family or anyone around for help. So it's been quite a struggle, like everyone else. Yeah.
I think for all the same here, I only have one teenager, but it's still a struggle. I think for all of us at the ILO, we have had personal experience of the problems of remote working. We've been in touch with the problems of the world's workers, perhaps in a way that in some other issues we aren't, at least not so directly. Yeah. So tell me, you've been the coordinator of this report. What do you think we've learned about occupational safety and health from COVID?
Well, first of all, that occupational safety and health is really important and that we can't take things for granted. So we've learned on so many levels in our lives as people who work and as people that are part of a community. But in terms of occupational safety and health, we've realized that if we haven't invested earlier in the different infrastructures and the different elements that we need when we face a crisis, it's not during the crisis that you're going to start setting them up. So it's a little bit too late if we don't plan ahead. That's what we've learned. And so we've seen that countries that had planned ahead for global health crisis, such as this one, were able to act really quickly and were able to integrate protection of workers in their broader crisis management approach.
What sort of things did they have in place? I mean, naming no names particularly, but what sort of measures or systems did they have in place that really helped, do you think?
So you really have to start off, at the national level by having regulations, by having that regulatory framework that people can be guided by. So what am I supposed to do as an employer? What's supposed to happen in this particular economic activity or sector? Do I have the right policy and strategy in a certain sector to prevent accidents and diseases and to prevent, for example, exposure and contagion in the case of this communicable disease? So starting off with regulation and countries who had regulation that were adapted to biological hazards, were able to react immediately in giving guidance. And so that would be the second step, making sure you've developed guidance. We were a bit lucky because there were some of these different viruses that didn't take a pandemic scope, but did affect regions and countries in a devastating way. And so there were these emergency guidance already in place for some countries that were most affected and others not.
You were talking about things like SARS and MERS and stuff like that.
Exactly. I mean, this is similar and not similar in many ways. But people who already had governments who already had national regulations in place on those issues, on what measures to be taken, what personal protective equipment need to be done, what distancing needs to take place, and all these thoughts that they've already gone through, they've invested in research in these, was important. So regulation was important, research and knowledge that was ready to go when you are faced with a new virus was important, and how to manage your workplace in that sense. So having that management system for occupational safety and health already set up for other risks and exposures at work helps. And you can take that system and apply it to a communicable disease such as COVID. So those were sort of the countries that reacted quickly, and they had institutions. So they had tripartite committees made of workers, employers, governments discussing already other issues. If that committee is already set up, it can quickly discuss a new issue and collaborate easier in an easier way, and then even reach out to other departments and governments and players, key stakeholders, to discuss and be ready as a unified group of world of work actors, to be ready to discuss the national level such a crisis. So being strong as that OSH system that we're trying to advocate for now help these countries have already have a name, have visibility, have guidance, have research in place, and have the tools to apply all of this to a new threat and a new crisis such as COVID.
That's interesting. So these countries, I mean, I think a lot of the countries we're talking about here are in Asia, because that's where SARS kicked off. They, as a result of that, they set up tripartite systems which they could then reactivate for COVID.
Yes, I mean, some of them did. Some of them already had it, regardless of the crisis. And it's not just, I mean, there are other communicable diseases that, like Ebola, that happened in Africa. There are others that we've learned from that have an immediate threat, and an immediate threat to healthcare workers also, that needed to be protected. So, which brings me, to where the threat lies, was the strongest. And it was really among these healthcare workers that have to deal immediately with cases that we know little about scientifically in the beginning, and they were not protected. They didn't have the right tools. So countries that already had, a preventive system in place, administrative also system in place, where, the shifts were working right, the physical barriers that they could just bring in and set up were there, the equipment was there. The countries, obviously, that are a bit more developed economically and have, realized the importance of setting up your health services right, was able to protect their health workers and provide a safer environment for patients. So that was sort of, we can see that. And we've seen that even developing countries suffer from that. So, there's this tendency that we don't invest in public services. We assume it's just going to happen. And we assume that people who work in this field, have a vocation to do so, and they should just do it and hardly be paid for it. So it made, I think, another thing we've sort of learned is it made governments realize that this is where, investment needs to happen, because if we're not alive and if we're all sick, we can't enjoy everything else a government provides to its citizens. And if we don't collaborate internationally, something like this, so communicable across boundaries, can take a toll on everyone and on economy and on the future of everyone's lives.
Yeah. I mean, it's often been said about COVID, nobody is safe until everybody is safe. And I think we can all appreciate that in principle that's the correct. But strengthening systems, particularly in developing countries, basically means more money, more resources. And these are the countries that, even if they've had the experience of SARS and Ebola, a lot of them don't have the resources. So who's going to pay for this?
Well, it takes on different levels, different measures. And of course, it's gradual. So we don't expect, a magic wand where people without the economic resources, or even sometimes the technical know-how. I mean, for a quick example, if you don't have trained physicians to recognize different diseases or potential exposures at work, they're not going to be able to diagnose an occupational disease. So if you don't even have that training available, the right technical knowledge, you're also unable to manage situations related to health as such. So yes, there is a need for financial investments, but it's gradual. And the need for financial investment comes when you set a policy that actually calls for it. Because the budget is there in most countries, it's where it goes. And it's trying to make sure you advocate that this is a priority, and you don't wait for a crisis to happen, or for a catastrophe, or for an accident or a fire, such as the one in Beirut, for example, to happen. And then you look back and think, oh, I needed a preventative system in place before that. So accidents are happening, global crises are happening, national crises are happening all the time. So investing is a choice because the budget sometimes exists, it just goes somewhere else. So you need to inject the money where you need it the most to ensure a safety net for your population. And so we work like at the ILO, our constituents in different countries, we work gradually. We don't expect, a magic wand. And here we come, to our international normative system that helps governments update their policies and national laws gradually and start implementing gradually and feeding the necessary budget and intellectual know-how during the process. So it doesn't happen overnight, but there needs to be a will. And some things don't need too much resources, and they're just about being aware of little changes you can do, raising awareness.
Really?
Yes, because sometimes you have the resources, you give people personal protective equipment, they don't wear them because they're not trained on why it's necessary for them to wear them, and they're not motivated, and there aren't enough rewards or enough consequences that are explained, etc., or regular training that happens in the right language at the right time, etc. So there are so many levels of making this work. So it's not just about injecting money into it or not, but about building that environment and culture where safety and health are important and people prioritize investing in them.
I mean, you talk to a lot of governments, workers, and employers in the ILO's member states. Do you get the impression that the prioritization of this has changed? Because in some ways, OSH in the past has been a bit of a poor relation. It's always tomorrow's investment. Has that changed now, do you think?
Absolutely. I can confirm that the atmosphere is very different today. Governments got scared. They were facing something they couldn't control. We've seen from the literature that workplaces were one of the biggest hubs and cluster of transmission because, people continued to go to work, people weren't protected. And it was a hub for transmission, even though, we don't have the proper statistics to globally announce different issues yet, and they will come as we look into them in more detail. But we've seen national statistics in different countries that really shows a high percentage that happened in the workplace. So this scared governments, and they needed to have, the tracing capacity, the infrastructure capacity, management system at the workplace. So they wanted to quickly learn. We see it in global discussions, such as the question of whether occupational safety and health should be a fundamental principle right at work. And we've seen a resistance to that discussion earlier. And recently this year in our, in the ILO governing body, we saw a tremendous amount of support coming into this needs to be a right at work. This is not a question anymore. We need to be investing in the safety and health of workers. Because the problem is, so when a crisis like this happens, you tend to neglect the other chronic diseases that were already going on. And so, governments were faced with decisions and trade-offs where people had to die so others can survive. And I think the effect of that will go a long way if we keep the momentum, because we know, it's easy to, to go back to our old habits and think, if we don't have an immediate threat, everything's fine. But unfortunately, I think governments have learned, and, the tripartite constituencies, social partners have learned, with difficulty and, through this terrible catastrophe that we're all living, that safety and health of workers is important, if not the least for the essential, work that needed to happen during the crisis, delivery of services, be it, the healthcare sector, be it the paramedics, people providing basic food and for people to survive in their homes during lockdown. We realize what's essential. We realize, how this needs to happen, and they need to be protected to actually deliver basic survival needs for the rest of the community.
So basically, we've all been taking it for granted, haven't we? I mean, I noticed that in one of the slightly scary statistics in your report is up to 20 or 30% of cases in some countries can be attributed to workplace exposure. So clearly, getting a handle on this, standards in the workplace are absolutely crucial.
Right. Absolutely. Absolutely. And that's why so much work has been going on to really encourage decisions at the workplace, to keep people from exposure to the extent possible through different means and regulations, and this is where we're seeing a lot of teleworking where possible and other means.
So, do you think that the workplace as we used to know it has gone? I mean, when we ultimately, finally stop working from our kitchen tables or wherever, the workplace we go back to will not be the same, or will we just ease back into that?
I wouldn't be able to predict, but there are several things to consider here. So, if we're talking about office work, that's one issue. If we're talking about agriculture, if we're talking about, I mean, we were already in a state where everything was moving forward differently. This pandemic fast tracked a lot of the changes that we were already facing anyway. And it sort of made it a normalized the way the work was being conducted, especially for those who can work from offices. Yes, I think there will be a huge change in going back to a full-time 100% office job when your work can be conducted from home.
Mm.
But looking at research, this is being, we're facing different opinions around this and different situations of people. Some people are begging to go back to a place where they can consider a workplace that's not, confounded with other responsibilities they may have at home for elderly, for children, and for the actual home management that they need to be doing. So this multitasking is not healthy and it's not long-term. At the same time, the flexibility to be available to use your personal time differently and choose when your personal time happens is interesting and is helpful. And so I think it's a halfway between,
Yeah. I mean, I'm interested in office work because the trade-off between the financial component of safety and the health of the workers is quite direct because, for example, it's things like the size of the office space that you rent for, say, 10 workers. Is it smaller? Do you go down the route of hot desking, which has been a growing trend and very popular among some companies and government offices because you save money. Things like sealed windows with no natural ventilation. Do you think people are going to be rethinking these? I mean, for example, will we see hot desking? Will we see sealed windows in 5 years from now?
I think it really depends on the nature of work and the nature and size of the company and the activity that people do and the general demographic of the workers that work in this activity. I think we've been trying out a lot of different workspace situations. Some have worked in some contexts, some have not. So I don't think we would be able to generalize a new workspace for all kinds of work. And I think we're still trying these different situations out, but I doubt that we would be able to adopt such new workspaces for all different activities at all. I mean, now there are two things we need to be considering: spacing out, if anything. Sharing is no longer really an option. So I think there's serious rethinking about how much sharing and open space we were having just before the pandemic, and how much now we're talking about distancing, isolating, ventilating. So it really depends. I think we need to strike a balance between understanding, communicable diseases at work and outside, and establishing a system. So airports haven't been the same since bombings have happened.
Yeah.
And I don't think workplaces will be the same after such a communicable disease has hit us hard and killed, a large number of the population in this century. So I think, many elements need to go into the thinking once we decide on what kind of workspace fits best for our demographic of workers, for the type of work that's being done, and for the flexibility that's expected from now on. I think a high level of flexibility needs to go into how we propose, jobs in the present and the near future.
Yeah, I think one of the other scary things that has come out through COVID is the new OSH, or occupational safety and health risks, that have emerged through these working systems. I mean, the chemical ones, partly related to cleaning, I guess. Ergonomic, people not working in specially designed offices, and of course, you've already touched on the psychosocial, which I think for many people is one of the most worrying things to emerge of all.
I cannot stress enough, Sophie, how important that is. Just by taking my daughter to school this morning, I'm going to just mention something because it really bothered me this morning. A mother walked up to me from a country not from Switzerland, and they're here as expats with her husband. She doesn't work. She just told me that she's now been forced to move back to her country because she's in a situation of domestic violence and cannot get any help. And by being locked down with her partner, this has exacerbated the situation for the past year, and she's found no resources for help. And this is just one example from this morning, and we're in one of the most developed countries in the world, and nobody can help. The changes that have happened, that people that used to travel, they used to be absent 50-60% of the time. They never had to face, the different psychosocial environment that you now face from working from home. Just speaking to psychotherapists and psychologists and around the world, the level of mental illness, I think this is the current pandemic above all. And I don't know how we can best now protect people from further damage, because as we know, once you have, mental breakdowns, it's very difficult to go backwards. And that's also been sort of the dilemma for countries to close down, open down, go back. People are dying from COVID, yes, but people are dying from other diseases and other, different kinds of diseases that are not, have been neglected, including the mental situation. And I think this is where worker managers, people in leadership positions in all occupations, should take this upon themselves to make sure that the environment that the different workers are living in are okay. And it's not that employers, or organizations need to do something themselves. They can make sure that they have referral systems for these people, that they have a list of contacts that these people can, and they understand the flexibility needed. So you can't, people aren't disconnecting when they're working from home, and you can't expect that. And you need to understand that juggling is okay for a month or two, but it's not long lasting. And you're going to lose your asset and your worker in the long time once they have a nervous breakdown from all the stress and all the development. So psychosocial risks have taken on an importance globally. In a sense, it's good because it's always been considered secondary. And it's not, and if you read the literature, soft skills and compassion and interpersonal skills have always been considered secondary, but they're not secondary. They're really the basis for people to continue to work, to continue to respect each other, and to continue to produce and not just be present rather than being absent from a type of job they're doing. So ergonomic risks, definitely. We're seeing, a rise in musculoskeletal diseases, eye issues, lots of problems with people, sitting at their desks all day and not having that, differentiation between a workplace and a home.
Yeah, it's 24/7. But I just want to take you back to the psychosocial issue for a minute, because there has been so much discussion of this, and from what you say, it's the sort of pandemic from the pandemic potentially. But what I'd like to ask you is, do you see, is there a gendered component to this too?
Definitely. I mean, we've seen historically that most services and most of these occupations are highly dominated by women. So, I mean, it's not that it's intentional that most violence is occurring against women in these sectors, but this is how it's happened because of the nature of such occupations that are about care and services. And so what's shocking is the amount of violence we've seen towards healthcare workers in healthcare settings, but also outside of healthcare workers. So, people have been attacked walking home because, they didn't get the treatment they needed for the patients or for family members, or they weren't able to see members. And this is not speaking about people working in supermarkets and in different grocery stores where people, were looking for different supply of different essentials and could not find them. Or others, other healthcare workers or even other workers that have asked people to respect certain measures and please, respect the distance, please put on your mask. And they've been met with a lot of violence and sometimes physical violence. And there's been a couple of cases of even murder in different situations in some countries. So it's taken an extreme because people are under an extreme amount of stress. They're fighting for their lives or the lives of their loved ones. And, everyone who's at the front line are those facing this violence, and then the psychosocial violence that comes with it, of course.
We're coming to the end of our time, really. So let me ask you to make a little look into the future. How do you think workplaces 10 years from now will be different from what we saw pre-COVID?
I think you can't not learn from such a catastrophe. This is a global crisis that, from what we understand, has not happened in this scale for the past 100 years. We're going to learn because policies have already changed. Regulations have changed. Trainings on different issues have changed. So it's now institutionalized. The way we deal with problems like this, the way we go to work and what we do will never be the same again. In many aspects, we're going to learn, we're going to grow, we're going to prioritize health, we're going to prioritize safety, and we're going to understand that occupational health and public health are overlapping. And what happens and what you do and how you prevent something in the workplace will have consequences on the community and the other way around. So there are no more there are less lines in the world today. This is not speaking of technology, not speaking of the virtual world we continue to live in. But we've been hit hard, and we've been hit hard where it hurts. And the world of work was already transforming, and now it will continue to transform, hopefully in an even more informed way. And as we apply the new institutional and legal and enforcement measures that are already in place. So this is how long-term change happens. It's by integrating it into your bread and butter at the national level, by realizing it. So it's not just a memory, but it becomes part of your law, part of your implementation plan, and part of your management system at the level of every enterprise.
I guess that also means there's going to be quite a bit of work to do to expand and update international labour standards and guidance to take these lessons learned into account, yeah?
Definitely. So the ILO is a bit behind in the sense that we have never had a standard that managing risks and biological hazards. And that's now being discussed to possibly be placed on the agenda for future discussions upon the request of governments and constituents and social partners. So we still have a long way to go to develop new standards, amend the ones we have, and improve in the way we manage and provide, long-term sustainable protections and preventative measures more.
Yeah, and hopefully that will be some kind of positive legacy to come out of all the suffering and the horrible things that have happened in the last year or so.
That's the only way to look forward, to at least learn properly, to be ready and to prevent catastrophes such as this one in any way we can.
Yeah, anticipate, prepare and respond, as you say in the report. Manal, thank you so much for your time and your expertise on this very important subject. That was Manal Azzi, Senior Specialist in Occupational Safety and Health at the ILO. I'm Sophie Fisher. I hope you will join us again soon for another edition of the ILO Future of Work podcast. Goodbye.